but I'm recording to the cloud, so I'm good now. Okay, cool. Okay. Ms. Dowler, it's good to see you.
Yes, it's good to see you too.
Big couple questions. Where were you when you first heard the news that we're going to have this whole pandemic coming? Did you hear about it like in February and January, or when did you hear about it?
I think it was in February when it was still over in China that they were talking about people over there getting sick. And it wasn't until, it was actually kind of, it was a strange moment. I was sitting in my nursing class, and there was a classroom full of us, like probably close to 30 people. Okay. And a lot of us have children. And so I remember sitting there, and all of a sudden, all of our phones went off. Like they started ringing.
Truly?
Yeah, and so we picked them up because the schools were notifying us that, you know, we're now, like, it's over in the US, it's bad. Like, we're sending your children home until further notice. Like, it was so surreal.
Wow.
Yeah, it was almost eerie how it happened. And then I think after that, that's when it really set in, like, this is happening, this is here. I remember even going to the grocery store shortly after class, and there was nothing. Like, everybody had already started clearing out the stores.
I know, I mean, that's crazy.
It was really scary, but yeah, that's how I remember it starting for me anyway.
As a healthcare provider, did you realize then that you picked the right profession, or no? Was it scary, or was it like,
I wasn't scared as far as like my job, like working or dealing with it, because we're already exposed to so many things that are deadly anyway. Right. So I'm like, oh, just, you know, bring it on. I mean, it's still, yeah, it's scary because it's the unknown. But, you know, my facility, we were very vigilant and quickly preparing for it. How
was that first meeting at your hospital when they said, here's what we're going to do?
You know, surprisingly, we didn't have like a face-to-face meeting. My manager had just, she gathered the info that she was given, and she sent out like a mass message to everybody. And she told us that if we needed to call, we could. But I mean, it was daily. Things were changing daily. Like, we would get an update every day of how we were going to handle it, what we were doing at the hospital, to protect ourselves, to protect people, to ensure that they, you know, get through it. And it was changing every single day. So I don't have the messages anymore, but I would have had a full thread of every day it changed. Something new was going to happen, or they were doing it differently.
It had to be frustrating, I would think, because
it did get frustrating after a while.
Like, when's it ever going to end? Can we just have something that's going to stay from day to day?
But, you know, being in healthcare and even like the science part of it, I understood. We didn't know anything about it. They're giving us the info as they do the research and what they think is best by their evidence. So I understood. It was frustrating, but I understood.
Do you think that many other people came to you, like especially your friends, that came to you for advice or for info?
You know, I don't recall anybody actually coming to me for advice. I know that on social media, I saw a lot of everybody had their own theory of things. It wasn't until I think a few months into it that some family had reached out and said, well, what are you seeing? Like, what do you think about it? And luckily, I work at 2 hospitals because they kind of, they're called sister hospitals, and we kind of share our employees based off who needs help. And okay. So I'm mostly at Shelby, but I can go to Mansfield, which is a very large hospital.
It's a big one.
Yeah. And at Shelby, we were considered a clean hospital, which meant people would come into the ER. If they needed to be hospitalized, they would be tested for COVID. If they were positive, we would send them out. We never took a COVID patient on the floor. They never came through the door, like the double doors.
Wow.
So we were fortunate enough for a while to not have that, but there was a few times where when they started allowing visitors, that our patients who had already tested negative and were doing fine, their visitors would come and then they'd start showing symptoms and end up testing positive. So we had to stop allowing visitors. because they were giving our already sick patients COVID.
And you didn't have, was there a protocol in place for that? What time frame is this? Is this like May, June? When was this? What?
I can't remember. I think it might have been towards the end of the summer. So like, yeah, June or July, August, maybe a little
Okay.
later than that. So I didn't get a lot of exposure to COVID at my hospital, but when I went to Mansfield, I did. I saw a lot of it, and then it got so overwhelming for them. They had so many cases that our hospital decided, well, we're going to do what we can to help you. We'll start taking COVID. We took the stable COVID. We couldn't take the critical because we didn't have the
Okay.
resources. We did that for about a month and a half before we realized, you know, are we really helping you guys out? Because then we started having to take their staff.
Oh, wow.
They got, yeah, we're only like Shelby isn't on, they're called, it's a critical access hospital. So we only have 25 beds in the whole hospital.
Oh, wow.
We're very small versus Mansfield, who has over 300.
Yeah.
So we weren't really helping them by taking COVID because then we started taking their staff. So now we're clean again.
Okay, so when was that decision made to stop taking them from Mansfield?
I think it was middle of January of this year.
Okay. So from, let's say, September till January, you had them?
No, actually, it was only like December to middle January that we took COVID.
Okay.
We had only planned on doing it for a short amount of time because we were hoping that it was during I think it was like the second surge of people coming and testing positive.
Okay. And when you say that they got overwhelming in Mansfield,
so they had a dedicated floor to have COVID. Okay. And when that unit became full, we would have to send them to other hospitals. Well, then those hospitals they'd say, well, we don't have any beds. We have no beds for these people. So then they had to start thinking about, okay, well, their units are pretty large. So they would take a unit and like split it in half, and half would be COVID, half would be non-COVID. They had to start doing it that way. They took regular like med surge floors and started turning them into COVID units.
So about how many do you think? I mean, if they got 300 beds, how many did they set aside in Mansfield for that?
I think the most that I recall hearing about, they had almost 100 COVID at one point.
Wow.
Yeah.
We're talking just like this fall, right? Not last summer or spring, but this fall?
Fall, yeah. It was like the most we had ever seen. Because for a while, everybody was like, well, we weren't seeing a lot of COVID. And we're like, well, these other hospitals are having like their parking garages turned into COVID units. I'm like, where are all these people at? And then it's just out of nowhere, these people started coming in with it.
Wow. You see, in Seneca County, I don't hear any of this. I mean, it may be happening,
yeah,
but we don't hear about it. We don't hear about this kind of situation, this recent.
Yeah.
All of us thought, well, it's been so long, so what's the big deal? Now, how did you guys feel about that the public knew about it? Did you feel that because you guys are exposed to it every day, you see it every day?
Well, it was kind of a little bit of everything. So some people were very vigilant. They're like, we're going to follow all these guidelines. This is a serious situation. And then you have other people like, oh, it's not real. It's just a conspiracy thing. They're trying, government's trying to control you, which is silly to me. And then there was other people who were like, yeah, it's real, but it's like a cold. Like everybody had their own idea of it because they hadn't either had it, they haven't been around anybody who's had it. And that's the unfortunate thing about social media too, is a lot of false information gets sent out there. And I tried to stay out of it just because, everybody's got their own opinion, but seeing firsthand how sick people were getting and just how what it was doing to them and their families, it just, when people say it's not real or it's not a serious thing, it kind of like breaks my heart a little bit because it really is. Like we're losing people in mass numbers because they're so sick they can't overcome it. And it's mostly like the respiratory part of it that was killing people because because they were getting pneumonia.
When you say that you had that people were dying, did you see in the hallways like the body bag people leaving, like people getting wheeled out? I mean, I don't know how that process works if someone dies in the hospital. I've never seen it.
I fortunately did not have to see that, but when they take people from a unit in a body bag, they try to take like the back route in the hospital so that way other people don't have to see it.
Got it.
It's just out of respect too. I mean, because
Right.
I don't know how many the Morgan Mansfield can hold, but I do know that it was getting full, that they were placing bags on top of each other. Like usually they have their own little shelf.
Exactly. I've been to a lot of morgues because I teach forensic science. I've been to a lot of morgues.
Yes.
But
I can't remember how many ours holds, but it was getting full. So.
And this is just recent.
That was probably
like November.
Yeah.
Because to many people, it's like, okay, come on, it started. To many civilians, I think, said we started in April. That was a big deal because it would affected everybody else, affected their jobs.
Yeah.
And once it went back to work, okay, fine, it's pretty much done until you hear about these kind of things. This is why I think, in my opinion, I want to do this because I don't know about this. I have no idea. And my mom was in a nursing home. My mom had it for about a month. She lost her memory for a month and then she came back. I want to hear about it from this side of things. And so when you saw your first couple of patients get COVID because of their visitation, because of the people who came in to see them, how did you tell the patients that they can't be seeing their family anymore, or that they were the cause of it?
Well, that was something the manager had to do. Like the manager put that in place, and then since I work at night, I don't deal with the family a whole lot. So a lot of the day shift nurses were the ones who had to make those calls, and that's where during the day is when you mostly see the visitors. So the front desk people, they're the ones who would have to say, oh, I'm sorry, we're not taking visitors. You can't be coming in, that sort of thing. So I never had to deal with that. But even again, the whole visitor policy, it's changed probably like 5 times. So
how did the hospital look when you had, when you're almost in lockdown? How did it look? Was it like a ghost hospital almost because you had no surgeries that were being done, or was it a normal functioning hospital?
To me, it didn't seem that way. I mean, yeah, we obviously didn't have a lot of visitors coming in, but like I said, at night, I hardly saw visitors anyway. But our staffing was about the same. We had a little extra help. So to me, it felt the same, just because at nighttime, everybody's sleeping, nobody's there anyway.
Right.
So honestly, I feel like the most exposure I've had to COVID was within my own nursing class, because half of us got it.
Seriously?
Yeah. All at once too.
When? Like what time? What month?
It was like from November through like the beginning of December.
Seriously?
Yeah. I was one of those unfortunate people too.
And you all had masks and everything.
Yep. Some people didn't know where they got it from, or some other, like they got it from family. I know where I got it from. I got it from work. And everybody's symptoms were different. So that
how'd you know you had it? I mean, what made you think you had it? Because of what?
Well, I woke up with like one of the most terrible headaches I've ever had in my life. And I thought that was just from lack, like I don't have a very good sleep pattern. I wake up a lot, I'm busy, sometimes I don't sleep at all. So I thought that was just contributing to it. Well, then my body hurt. Like I felt like I had been working out at the gym. I was so sore and I just felt run down. So I just kind of those were the only 2 symptoms I had that day. So the next day I woke up, they were even worse. Like those 2 symptoms were even worse. So then I went and got tested. I found out the next day that I was positive for COVID. And by then I'd lost my smell and my taste completely.
Wow.
And I didn't get that back for like probably 5 or 6 weeks.
And when did you know that everybody else had it in your class? I mean,
So
this is,
they
this is
found,
November, you said?
what's that?
November?
Yeah.
Okay.
So the day before I found out about my case, a girl in my class, she was just she was very sweaty. She just felt ill, and she actually had come to clinical, and we were standing there, and she was just like dripping sweat and just kind
Wow.
of staring off into space, and we're like, "Are you okay?" And she's like, "No, I don't feel good at all." So our instructor's like, "You need to go home." So she got tested, and that's when she found out. She doesn't know where she got it from though. But a lot of the girls had different symptoms. Like one girl had like sores in her mouth.
Truly.
That was one of her side effects.
Wow.
Very, very painful sores. And
so what they make you do school-wise? I mean, they make you stay home for weeks, for days, what?
the quarantine was for 10 days. And if we were not showing symptoms, we could come back to class. There were some symptoms that they kind of like let go because they weren't going to go away. Like I had a dry cough, and that I just recently got over the cough. Like nothing was coming up. It was almost like having a dry throat.
Right.
And it's irritating. That's what my cough was. And then I still get headaches. So those types of symptoms.
As bad as the first one?
What's that?
Bad as the first one you had?
Not as bad, but they're still pretty intense when I get them.
Wow.
Yeah. But yeah, after the 10-day quarantine, we were allowed to come back as long as we weren't showing certain symptoms. And we were Zooming for class time until everybody was okay.
How about your family, mom and dad?
My parents unfortunately have passed away years ago. Yeah. So luckily they didn't have to go through this. But my family, like my 2 kids and my husband, none of them got it.
Fantastic.
And yeah, and I was just like, because when you have it, they want you to obviously stay away from the other household members. You know, the health department, when they called me, they're like, you know, if you're going to be out around your family, everybody needs to wear a mask. At night when you're sleeping, sleep in a completely different room. And by then, like by the time I had found out that I had it, they told me I had been spreading it for 4 days.
Okay.
Based off of when my symptoms started.
Okay.
And I'm like, well, I've already exposed my family then. And it was really hard to get my children to understand, you can't be hugging on me, don't be in my face. Like, we have to try to, you know, stay apart from one another, because I really did not want them to get sick. But they didn't listen.
Of course not.
No. And even my husband, like I was like, you know, let's not kiss because I don't want to give you anything. But no, they were fine. Nothing. Absolutely no symptom
That is
whatsoever.
fantastic. Now, how old are your children?
My son's 10 and my daughter's 6.
Yeah, you can't just say don't be around mom for the next 2 weeks.
I know.
Yeah.
My daughter especially. She likes to cuddle. So.
Well, I'm so glad they didn't get it.
Yeah, me too. And you know, that was the case with a lot of people that were staying at home with their families trying to get over COVID. No one else in the household got it. And if they did get it, they didn't show any symptoms. So like it was, I don't know. It's amazing like who it chooses, you know?
That's the thing about it. You can't track and trend this thing because not everybody, the symptoms are so different and not everybody gets it. It's like selection, you know?
Yeah.
It's hard to track and trend something when you have that kind of characteristic. As a scientist, I'm looking at it from that perspective, but you can tell from your same thing as a nurse.
Yeah.
It's hard to track and trend something when the symptoms are all different and people may or may not get it. Wow.
They tried to track it. They sent me this thing where they wanted me to report all of our symptoms every day, like in the morning and at night. But it got to be so much. Like they were like text bombing me wanting this info, and I was just like, please stop. I'm like, it's so difficult trying to send this info so that they were trying to get a trend,
Right.
but it was just way too much.
Especially when your kids didn't get sick. They kept probably got asking for that too.
Right. They wanted a temperature too. They wanted to know what everybody's temperature was twice a day. And I'm just like, by the time I thought about it, I'm like, I'm in the middle of the day. How accurate is this? Are these numbers going to be? You know what I mean? Like,
Yeah.
it wouldn't have been consistent. So I just didn't even participate.
Now, when you had it and you were off, you weren't working. You weren't working anymore for those 10 or 14 days or whatever, right?
No, I had to stay home completely.
Okay. All right. So when you went back to work and you had it and you went back to work, how many people how many people working there that have had it or not? Half?
I think when I went back, there were 5 other staff members out with it. And we're a small hospital anyway. I can't tell you how many staff we have, but there's been quite a few of us that have had it.
Was anybody in that hospital when you had that time frame and you're taking patients from Mansfield, anybody had to go on a ventilator in your hospital?
No, we didn't take anybody with vents because we only had one in the entire hospital, and that was for ER.
Okay.
We didn't have the proper staff for that, and if they were so sick they need to be vented, they would be over in Mansfield or one of the Columbus hospitals.
When you went to Mansfield, you said you work at both hospitals. How many times did you?
I was probably going over there once a week.
Okay.
To help out.
When did you? And that was going on through the peak period in November.
Yeah.
How many people there were on ventilators that you saw?
The only one I saw, I'm trying to think if I saw any, because usually the people who are ventilated are in an ICU because they're very critically ill.
Right.
And I'm an LPN, so that is out of my scope of practice, and I can't take they don't take LPNs in an ICU.
Understood.
And then they would not have given me a patient that was on a vent. So
it was a whole different floor then, right? When they had it.
Yeah.
Yeah,
usually the ones that were out on the other units, they were pretty sick, but they were not sick enough that they needed to be vented.
Okay. Could you confide in them and let them know that you had it too, so you know how they feel? I mean,
sometimes I did. I was very uneasy about telling people because once they hear it, it's like, oh, she's had COVID. I don't want her near me. Yeah. I didn't want that to happen.
Right.
But they would ask me like, oh, well, what did you experience? And I would tell them, and I don't know, it seemed like everybody had their own, it was a different experience for everybody.
I would think that as a compassionate person as you are, that it must have been hard to say, I know how you feel because I've had it.
We have to refrain though. They teach us, we can be empathetic, but we don't want to say, well, I know how you feel. They don't want us to say that because in reality, we don't. And it can come off as, it can become offensive to some patients, so that they actually teach us in nursing school to be very careful how you say things.
Wow. I didn't think about that, but you're right.
Just for example, if somebody's been in the hospital for a couple weeks and they're like, oh, I can't wait to go home. And I'd be like, oh, I know exactly how you feel. And they're like, no, you don't.
Yeah, I could see that.
Yeah.
What ages did you see in your hospital? I mean, is it primarily all over the place, or is it elderly, or is it young, or what?
I mostly see elderly.
Okay.
Over at Mansfield, I did see a couple of young ones, but they were up walking around doing their own thing. They were just there for IV antibiotics or something like that.
How is the anxiety level of the staff when you know that anybody can get it any time?
It wasn't necessarily about who would get it. It was, and it's almost like you'd have to work on the unit for me to, it's hard for me to explain, but coming from a typical med surg floor and you're doing your normal thing, it can be stressful, but it's decent. But when you go to a COVID unit, it's like, my first time working on the COVID unit, I looked at the staff nurses who are normally over there and I said, I don't know how you ladies do it. Just the PPE part of it was hard for me because you've got your N95, which is suffocating enough. And then you have to wear like a face shield. You're putting on these gowns, and the gowns, it's almost like they hold in heat. And you're in these rooms for like over sometimes an hour because they want you to do cluster care. They want you to do everything at once to minimize how many times you have to go in there.
Okay.
So you're in there for like an hour at times. And so it's hot, you can't breathe. You start to sweat too. So then it just makes caring for people even more difficult. Plus the one, like some of them, I don't want to say they were needy, but they just required a lot of care. And so by the time you get out of their room, you're like, oh my gosh, I have 3 more I have to do this with.
Oh, wow.
And by the end of the night, by the end of a 12-hour shift, it was just so exhausting. And I really, my heart goes out to the people who do that every shift. I'm like, I'm only doing it here and there and I'm complaining. I can only imagine those who are there every shift.
When you change rooms, did you have to change all your PPE equipment too?
Yeah. So because of the shortage of masks, they did it to where the face shield had to be cleaned. We just wiped it down with these like PDF wipes.
Okay.
We wiped those down, let them dry. We would put on new gown and gloves. Our mask we could use, I think it was up to 3 rooms, and then we had to change it.
Okay.
But it was like, if we were going to come out of a room and it would be like 30 minutes, we had to change it regardless. It was if we were going to go from room to room to room, we could keep that same mask.
And this is in November, give or take.
Yeah, it was the last couple months, yeah.
Okay.
That they implemented that.
And you mentioned that there was a shortage of masks?
Yeah, we were just a lot of us, they went to a new, like a different brand. And so a lot of us we have to be fit tested, of course. And a lot of us were failing the fit test for the newer masks. So we had to use the old masks that they were doing away with. So they were on low supply with those, because I used the old masks.
Okay.
And so we just had to be very careful with how much we used.
Because we, again, when we hear from our side and civilian side is that, we got plenty of masks, got plenty of ventilators, we got plenty of everything, where we didn't have that in March and April. And to hear that the situation created that based upon the new masks versus old masks, but still, that's something that we thought we got plenty of them.
Yeah.
And there it is. It's not.
And it's not that it's like we were using so many of them, we couldn't get them in fast enough. That's where the shortage came from.
I would think they would have to know that when you have that many times, you have to throw it out after so many times.
Well, and that's the thing too with N95s. They don't get thrown away. They get put in a bag. And then I think, I don't know how often they do it, but those get sent out and they get cleaned.
Okay.
They get cleaned and then they get put back into a hospital for use.
If you had a chance to share with the mass public a message to them about the whole COVID crisis that we've been through, what would you hope that they would want to get from it? I mean, when someone sees your piece of art, what would you hope that they want to get from that message?
Well, I mean, I hope that they know that there is a light at the end of the tunnel, that it's not always going to be like this. That I know a lot of us had gone through depression because of it. A lot of people had killed themselves because of this. I guess my biggest thing, I want people to stay strong through the whole thing and just be there for one another instead of feeling like there's no end to it. That was my biggest thing. Like, people were so depressed because of it. And it was just really disheartening because, nobody knew how to deal with it. And, it's just trying to support one another and stay strong and just do what they're being told. Like, the biggest thing was, like, just follow what they're telling you, because they're telling you it for a reason. And if we can all do this, we'll get through it. Like, there is hope.
And they're not trying to control you. They're doing it for a real reason.
Right. Like, I know nobody likes being told what to do, but they're like, well, I don't want to wear this mask, so I'm not going to. You know, if it's such a lot of them, they don't understand how the mask works. Like, it's not necessarily for you to be protected from the COVID. It's the mask is protecting other people from you if you have it. So if everybody wears it, the chances of somebody getting it are very slim. But then you also have to take into the fact that people need to wash their hands consistently. They need to clean their home. Like, one of the things that we were told was sanitize your home daily. Like, wipe your tabletops down, clean your light. I go around and I clean my door handles and I clean the light switches, because we touch those a lot. Yeah. And they say to clean those every day. And that seems like a little excessive, but if we don't do these things, it's not going to slow it down if we don't do them.
When do you think, as a professional in the healthcare field, when do you think that the tunnel we're through it? This year?
It's kind of hard to say, just because I'm not exposed to a lot of things that people think that we are. There's a lot of stuff we don't see. There's a lot of behind the scenes stuff that we don't know about until, you know, days or weeks later. Like, as far as like decisions that are being made, or what they're like number wise, like, we don't know statistics until we're told them.
Right.
So,
you think this summer or next summer?
I want to be hopeful and say this summer that we'll see a huge decrease in cases, because now we have the vaccine.
Right.
But that's another thing. The vaccine is unknown. Like, we don't know exactly how it's going to affect us in the long run.
Did you have to take one?
I did not have to, and I chose not to, because I'm still within my 90 days of having COVID.
Okay.
And I heard a lot of the people who had taken the vaccine, it was making them very sick. It was worse than what normal, like, other people who haven't had it were getting. And that's another thing. The COVID vaccine, it was the second dose, which we knew about. We had heard that it was making people really sick, that second dose. And I did see firsthand some of the nurses, they were like saying they wish they would have never gotten it, that if they have to take it again, they're not going to. One of the nurses actually went home in the middle of her shift because she was so sick from it.
Wow.
And I'm like, wow, the way that they were acting, I'm like, I think that you guys were worse off than I was, and I actually had COVID. So I wanted to wait and see how. I wanted it to be more established, is my thinking. Like, I want to see all the side effects. I want to make sure that they work out the kinks, because, you know, there was also people in nursing homes, like, in mass numbers, they were like dying from the vaccine. I don't know if they ever proved that it was the vaccine, but they had been given it and then they died. So it just
my mom was given the vaccine, but a month ago, I think.
Okay.
She had it. And my son, he's in med school at Toledo, he's got a second shot. He had that on Friday. Mm-hmm. So again, he's not feeling too bad. We had lunch together.
Yeah, there's some nurses who it didn't affect him at all. And I just want to know for sure before I do it.
Yeah, because you have to take care of children and you have a family. So exactly.
And I'm all for vaccines. Like, I'm not an anti-vax person. I wholeheartedly believe in them. But this one, I was just a little skeptical about.
As everybody is, because it got, you know, when you have to rush it and then you don't know anything about it. I talked about the polio vaccine back in the 40s, because she knew people with polio. And she knew people who were in iron lungs, and they were at graduation that she pushed down the aisle.
Oh my gosh.
She said that the unique thing about the polio vaccine was, and the whole thing about polio wasn't that how many people got it. It was that you didn't know if you're going to get it or not. They had no idea how it spread, and they had no idea how people reacted to it.
Yeah.
It was the fear and the fact that it affected children.
Yeah.
You know, that was the main thing that caused the fear in people in the polio. But when
I actually did do some research on the polio um, pandemic that happened. And I think they said it was like 3 years it took them to find a vaccine.
Yeah, and the biggest reason was, and I try to teach this to my students when I get to toxicology. The biggest thing was because it had such a small percentage of people who got polio who reacted to it. Therefore, you had to have this huge number of people for the test subjects, millions.
Yeah.
And the unique thing was that when they came out with the test, all the parents wanted to have the real vaccine, but you can't do that. You have to have a placebo. You have groups that are put together to make it a good blind study, and parents didn't want to hear that.
Yeah.
I want the vaccine for my kid. I don't want the placebo. So no one knew who got what except for Jonas Salk. He's the only one who knew it. He had him coded by certain numbers. He knew which was the placebo, which was not the placebo. And so, but everybody thought they all got the vaccine, but they didn't. It's an amazing thing.
Oh, okay.
It was an amazing thing how they pulled it off. And it was the very first national approach to a disease. We didn't approach the Spanish flu the same way we did the polio vaccine. We didn't.
Yeah.
Wrote it out. We didn't approach it like we did the polio vaccine. So it was an amazing thing. Anyways, I don't want to keep you anymore. You've been fantastic. Thank you for this. And what we'll do is we'll send this audio to an artist. We'll have two artists. We'll have a high school student. And I want the high school students to hear these stories and make them so they know that it's real.
Yeah.
And then we'll send it to a professional artist that you can get a professional piece of art, like 2 foot by 2 foot, framed and everything. You can have it in your house so that when you're 70 years old, you can look back with your grandkids and say, I went through it.
Oh, that's awesome.
That's the main reason why we're doing this, because I want you guys to know, but we appreciate everything you do.
So I can see the art when it's done?
Absolutely. Yes, then you'll meet the artist too.
Oh, okay.
We'll have the showing. We'll have an exhibit in the Tiffin Art Guild, if you can make it. It's sometime in May. I'd love to have you there.
Oh yeah, definitely. Let me know. That'd be awesome.
We'll have it on the weekend, whatever days everybody can make it. But I think it'd be fantastic to see all the different stories together in one big piece of art, in one big gallery exhibit. It'd be phenomenal.
Yeah, that's great.
Perfect. Well, listen, it was fantastic. Tell your children and your husband that I appreciate your time.
Yeah, thank you.
You locked yourself in the room.
I did.
And they were very quiet. No one pounded on the door or anything. It was fantastic.
Well, funny enough, my husband, I don't know if you saw me look over. He had opened the door and I looked over at him.
Well, thanks again. I appreciate it very much. And we'll be in touch, okay?
Okay, thank you.
Okay, bye-bye.
Have a good day. Bye.
You too.